Thanks for joining us here on Republic TV, and at 6 p.m. every evening, we at Republic TV have been getting you experts talking about how we can effectively counter COVID-19, fight COVID-19, medical experts from different domains. And today we are talking about how technology is being used to fight COVID-19. And we have a special panel joining us as we discuss this new technology and different innovations being brought into the market by different people, different companies. Let me first of all introduce our panel this evening. Dr. Raja Kumar. Let me introduce Dr. Raja Kumar. Okay, there he is. Dr. Raja Vijay Kumar, who's the inventor of Coronaguard and global chairman at organization Die Scalene. We have Royal John Augustus, who's the founder, president, and the COO at Sri Scalene Sciences, Cardiotech and Therapeutics from Maryland, America. He's joining us on the show. Professor Dr. Meena Augustus is on the show with us this evening. Good evening, Professor, who's the co-founder, CEO, and Chief Scientific Officer of Sri Scalene Group of Companies. Mr. Anton Jonglot, who's the Director, Scalene Europe, joining us on the show this evening. Dr. Anil Balani, who's an MD in internal medicine associated with leading hospitals in India, will be joining us soon on this broadcast. Marzin Shroff is on the show with us this evening. And Marzin is the managing director and CEO at Eureka Forbes. So thank you to all our panelists for being a part of this broadcast. Let me start with the inventor, Dr. Raja Vijay Kumar. Very challenging times that we live in. Of course, companies having to innovate, find new technologies to fight COVID-19, to fight the different viruses. Tell us a little bit about this technology and how you discovered it.
Technology was not made for what is it? We developed for create the influence only for our family and friends. 2019, when the COVID was there, and then took it to the level of we did, and after the started out, then it became a project business, lot of fun, became a very serious thing. So that is the
Yeah. I have a poor audio line with you there, Dr. Vijay Kumar. I'll just fix that. But let me take my next question to Marzin. Marzin, how did your company think of partnering this product, first of all? And tell us a little bit about the different testing that has happened and the validation that you have, and how challenging has it been to bring a product like this into the market?
You know, for 40 years, we've been at Eureka Forbes been fighting with bacteria and viruses. We've been doing this in water, we've been doing it in air, we've been doing it over all kinds of surroundings. And as a friend for life, we genuinely believe that we are here to protect the customers of ours, here to protect India and make sure that we make a positive difference. We've been working with Dr. Raja Vijay Kumar on quite a few other projects on water, etc. And we've been in touch with him. So during COVID, when we were talking to him, you know, he talked about this solution that he's proposing and a product called the Shikocan. We've always believed that, you know, this is a fantastic opportunity, and we thought that we could make a difference to the world by launching a product like the Coronaguard Shikocan. So this test, as you asked about the tests have been done in many reputed national, international laboratories in North America, in India, and even being tested in Europe right now. So we tested it at the LEI Institute in Mexico. You know, we tested it in IIT Guwahati. We tested it at Madras University with the IFMO lab, which is, you know, a subsidiary of an American company. And what we've got is we've got proven disinfection efficiency at 99.9%. Now, these tests give us the confidence that in times like these, the product will ensure absolute protection in enclosed spaces. We've done testing not just in the area of efficacy, but also for electrical, environmental, safety tests, both on humans and on animals. And it's been absolutely safe for humans as per the results we have got. While we've been testing it in Europe, maybe Anton can share, Dr. Anton Youngblood can share about some more about the tests that are happening in Europe as we speak.
Yeah, let me take it to him. Anton, can you tell us a little bit about where you have installed the ShycoCan in Europe, and a little more about the product and the technology?
Yes, we have installed one of our first installations was a funeral home, and in that funeral home in the Netherlands, there were about 2 infections every week, and I don't know if you can still hear me.
Yes, we can hear you, Anton. Go ahead.
Because it says the call is ended.
We can hear you, Anton. Yeah, you're audible. Go ahead. Okay, while we fix that, let me take it to Professor Dr. Meena. Professor, tell us a little bit about the norms in different countries, right? For example, the norms in the US for such devices are extremely stringent. What is the view of the scientific community and the administration towards such technologies and such devices? What is the technology behind this product? Okay.
There was an installation, and what appeared that in one classroom there was not yet the right electricity.
Yeah, we can hear you, Anton. Go ahead. Okay, we'll just get him back. We just lost the line with him there. I think he's just getting back. Okay, I can hear you, Anton. Go ahead. Anton, go ahead. We can hear you. Yeah.
What did you hear? What did you not hear?
We lost you at the point where you were explaining the technology to us.
Okay. Did I tell you about the funeral home where we installed it?
No, go ahead.
Okay. We did our first installation on 20th of November 2020, and we installed about 20 devices in a funeral home. Before the installation, they had about 2 infections every week, because also the situation in the Netherlands was very severe. And they had many funerals. And after installation, there were no more infections. So up till now, already more than 6 months, we have no more infections. Our second installation was in a school, primary school, and the primary schools were closed for a certain time. Then they went open, but parents were very concerned about the pupils, their children, and also who were very concerned were the teachers. So we installed in all classrooms the system, except for one classroom, because there was not yet the right electricity. And in that classroom, we had 2 infections, and the teacher was infected. But further on, nowhere, in no classroom, there were infections. The second thing we did is we asked the National Dutch Research Institute, called TNO, and we asked TNO to review all the tests that were done in laboratories all over the world. And TNO concluded the tests were sound and presented in the right way. There was one more thing they advised us, that was to test with SARS-CoV-2, because until so far only tests were done with the WHO's advanced surrogate viruses. So we did also, TNO also did the test with SARS-CoV-2, and it was confirmed that the ShycoCan eradicates SARS-CoV-2 as well. So that's a very positive result. And with our European distributors in Germany, Norway, Denmark, and France, Bulgaria, Serbia, we plan to go ahead now. And our first aim is schools, because most infections come through the schools. Thank you.
Yeah, thank you for that. Let me go across to John Augustus. Rahul, John Augustus, you know, you've served with the Embassy of India. You've worked as an advisor to defense technology to the Ministry of Defense, Government of India. So you know a thing or two about technology transfer. How difficult and how challenging is it for you to, one, get such technology into India, and to ensure that, you use it for mass production and people get the benefits of it?
I think basically I've been working with Dr. Raja Vijay Kumar for the last 25 years now, after I left government service. And what we found was, the idea was basically from thought to therapeutics. Now, once you are in the position to bring Indian technology to the West, the important thing is to satisfy all the requirements that are needed. For example, in the United States, I know that Professor Meena Augustus can talk more about that, but we have to go through the entire gamut of all the requirements to have it approved by the FDA. So whatever be the technology that we are bringing here, we have to prove it on home ground in every country, we believe. So it's not just a question of having the technology and keeping it on a shelf, but bringing it out here where every technology that we bring can be used for the benefit of mankind. And that's what we've been working with Dr. Vijay Kumar for the last 25 years, with all the breakthrough technologies that he has been bringing.
Right. Okay. Let me take that to Dr. Meena. Can you hear me now, Dr. Meena Augustus? Can you hear me?
Yes, thank you so much. Yes, okay, I can, great. Niranjan.
Okay, now the norms, he was talking about the technology transfer. And looking at this product and the kind of validation it has, of course, from the topmost institutes, the norms, of course, in countries like America, for example, for such devices are extremely stringent, and they will be. What is the view of the scientific community and the administration towards it and such products and technology?
So that's a great question. During the public health emergency in the US, for example, there is now something called the enforcement discretion for products such as these that are going to be useful, but at the same time, given all the other important factors like looking for a new drug or a therapeutic or an antibody and testing kits and all of that, the US FDA had released a regulation that says some products like air purifiers, disinfectant units, medical recirculation units, which is what the Shaiku-can is, can be brought under this enforcement discretion. So one thing I want to make absolutely clear, that to bring this into the country, you need to have some stamp from the US FDA. We don't get it in a formal written process, but we work with a regulatory consultant, Emergo by UL, to get it done. Now that said, we have been communicating with the highest levels of the scientific community, sharing this information, bringing all the biological validation to them one-on-one, getting it rigorously validated, both in terms of going back to the results, talking to the scientists that did the results, making sure that all of that is compiled, and we are in the process of compiling a 510K for what is called as a US market clearance. The word FDA approval is used very lightly by people outside, but here in the US, we have to make very sure that we're using the right language, and it is not approved, it is not cleared yet, but it has been notified to be marketed under enforcement discretion in the United States. That said, we have, like I said, spoken to top-level officials for purposes of confidentiality. I can't tell you what they are and who they are, but we do have tests now currently ongoing in a national biocontainment lab and a BSL-3 level, where we are testing it against the SARS coronavirus, and we will be also getting those results very shortly.
Okay, let me go back to Dr. Raja Vijay Kumar, the inventor. Okay, I think I lost the line with him. I'll go back to him, but let me take a question from Marzin. Marzin, what is the feedback that you're getting for such a product, and what is the requirement for such a product in the market? I mean, a lot of curiosity. People want to know how it works, and does it kill the family of coronaviruses, for example?
So the feedback is actually fantastic. The product has been installed in over 130 leading hospitals across India. It's been installed in schools, in banks. A leading bank has installed it almost across their branches. And the product is getting fantastic coverage in terms of visibility of where it is, in terms of the restaurants, in the offices, everywhere, homes. The problem is that we are not able to supply enough at this stage, and we're trying our best to make sure that we are able to cater to the demand of all the needs that are there in the marketplace.
Okay. I can imagine, at a time like this, because a lot of people, while we were in the course of, just broadcasting the show, a lot of interest came in and people were asking, they wanted to know more about how this works. So let me go back to Anton. Anton, tell us a little bit about the test results, if you may know a little bit about the preliminary test results and what they show globally for a product like this.
Yes. There are, of course, numerous tests with surrogate viruses, and these results are excellent. But then we also did a test, or at least the National Research Laboratory did a test with SARS-CoV-2 on stainless steel plates, and then these plates were exposed to the Shroff during periods of 1, 5, and 15 minutes, and there was a control that was not exposed. Now, the exposed plates showed a reduction in the virus of 95% within 15 minutes, but the control did only show a reduction of 1% after 2 days. So in 2 days, the virus was reduced by 1% on the control plate, but on the exposed plates, it was totally eradicated.
Yeah.
Well.
Yeah.
And that's very good, impressive results.
Okay, impressive results. Okay. Professor, okay, Dr. Anil Balani is also with us now. Let me take a question with him. Dr. Balani, how is, coming back to some basics of this the second wave that we're all battling. Can you hear me, Dr. Balani? Good evening. Can you hear us? Okay. Okay, we're just connecting him 1 second. Okay, meanwhile, let me take a short question with Dr. Meena. Dr. Meena, how does this technology work? Can you break it down for our viewers? What is the science behind it?
Yeah, so very simply put, the mechanism by which the SARS coronavirus and the corona family of viruses associates and impacts or infects the human host cell is through an appendage on the membrane called the S protein. Now for this membrane, the S protein to attach to the host is what causes the infectivity and the virulence of the different species of coronaviruses. Now Dr. Kumar's technology has the mechanism of a photoelectron discharge that is emitted from the device on the switch of a button. And because it is so safe and it does not have any deleterious effects, which has been tested in bronchial epithelial cells, the cells in our nose and our airways, you are able to have this negatively charged electron bind to this positive charge-seeking S protein on the membrane of the SARS-CoV-2. So given all the biological validations that you heard about from Anton and then what was done at IIT Guwahati, and the fact that a lot of the validations from Mexico in surrogate viruses, which are EPA approved, as well as the influenza B virus, for example, we were able to show a significant reduction of about 99.994% also in a bacteriophage, the MS2 phage. Now this implies that there is the effectiveness of the electron discharge binding to and neutralizing or disabling the mechanism by which the coronavirus actually binds to the host and infects it. It's a very simple technology. Again, it has the background in the science that Dr. Kumar is probably the best person to talk about, but it has been validated biologically. And as a scientist, for me, the rigors of scientific validation is what needs to be appreciated so that we can actually use this product as a humanitarian collaboration across the globe and help people that are really struggling, in different parts of the world, including India particularly.
Yeah. I think Dr. Balani is with us. Can you hear us now, Dr. Balani?
Yeah.
Can you hear me?
Yeah.
Great. Okay, fantastic. So, how is this wave, the second wave, different from the first? And for, we're talking about this product, technology and innovation to fight COVID. What are your thoughts on that?
Yeah, see, this virus has hit us with a wham for the simple reason that this is a double mutant. When we say double mutant, means there are two mutations that has come up in this virus. And there are two very, very deadly things about this virus is that it is very, very highly transmissible and very, very infectious. So these are the two issues with this virus. And that is why the spread has been very rampant, and it seems to attack the immune system of our body and thereby creating havoc in the lungs as well. So this is the most dangerous thing about this virus. And that is why this second wave has been particularly more dangerous. The transmission is very, very rapid in this, and the infectivity of this virus is very, very high.
Yeah. Let me get in the last word from Marzin. Marzin, are you looking at this device as a solution for India alone or even to the rest of the world? How many countries are using this now?
Oh, you just heard Anton saying that it's used across Europe, all the way from Norway down to Germany and further south as well. Yeah, Professor Augustus and their team is looking at North America. It's been Meena tell us about the Canadian approval to go ahead and market the product in Canada as well. So we've got approval to market in Canada, in the United States, and through copy paste into most of Latin America as well. So it's a global initiative for us to start protecting lives, and the goal really is to see how many people we can protect across the world, not just in India. So there are different partners for the project in different parts of the world, and we'd like to make sure that the world is a safer place to live in. That's the goal eventually.
Yeah. Okay, I'd like to at this point thank Dr. Raja Vijaykumar, Marzin, Professor Dr. Meena, Anton, Dr. Balani, and to all our panelists who joined us. Thank you for your time, and hopefully technology can play a big role in the fight against COVID-19 as well. Thank you very much.
Thank you.
Thank you, Niranjan. I appreciate it.
Thank you.